Psychoanalysis in silence. Psychoanalysis as a discipline is believed usually to work in language. So much so that the work of psychoanalysis outside of language is no longer at the center of deep and enduring discussion and training, especially after the advent of linguistic philosophy and its consequent effects in the area of philosophy, literature, and psychoanalysis, where we started believing that reality is constructed by language, which is quite different from saying we process reality through language. The two are very different. Processing reality through language, or primarily through language, to be more accurate, and constructing reality out of language are completely two different things. Constructing reality out of language is a form of a variant of extreme subjective idealism rendered in the linguistic flavor. We will discuss today the aspect of psychoanalysis outside of language. Psychoanalysis in silence, how it exists, how it works. The first point that comes up in this context is psychoanalysis is supposed to be a language-heavy enterprise, and does it ever operate in silence? We have to look here at three aspects which are connected: silence, sound, and language. If we look at early life communication of a child, it happens in all the three ways. It happens in silence through projective identification. It happens through sound of crying, of weeping, which are accompanied by body and facial gestures. And we also see communication happening in language once the child acquires the language. And there is a transition period where the child starts understanding language more than he is able to use it for speaking. Lacan also talks about the real, the pre-linguistic real, and the post-linguistic real, both beyond language. There are some traumas which happen at that period, and it is like a complex to which we want to throw a chain of language to catch up with it so we can pull it up and start processing it in terms of language. And if the chain is able to pull up those memories toned with affect, in Bayesian terms, we have converted the beta element into an alpha element, which is now ready for being processed. But if we are not able to connect language to something strongly experienced in pre-linguistic period, then it's very difficult to bring up that memory, analyze it in terms of language, and undertake catharsis of feelings involved in that experience. Some stories can never be told. And one part of that are the stories which are outside of language, which have happened before language, or which have happened at depths where the story has been created without the use of language, and language is unable to infiltrate into that story. So these are some of the early life and traumatic psychoanalytic events which happen outside of language. Three more elements stand out in this regard. First, the whole point of transference. Second, projective identification. And the third, ineffable O. All the three are extremely important in therapy, and all of them are outside of language. All the three happen in silence, neither in language nor in sound. It happens in silence. Very important area where psychoanalysis operates in silence. We all know as counselors, as therapists, how transference, countertransference operates in silence, how projective identification operates in silence, and how the ineffable O that Bjorn referred to, that also operates in silence. In the session, the non-verbal facial communication, body language communication, communication of stance also is factored in the therapy process. In ISTDP, we make very vivid use of the movement of eyes away from the therapist, of the person going back into his chair, or the person expanding his chest while experiencing certain forms of feelings. So, use of psychoanalysis outside of language is very clear in ISTDP, in ordinary psychoanalysis. And there is a very large area of training, which unfortunately we don't do, which is, or we don't do adequately, which is training related to what happens inside of us outside of language. It is also necessary, therefore, that we manage our interventions, both interventions of commission in language, interventions using just sounds, and interventions which are non-linguistic. Interventions of omission and commission of silence at different points. So it's an area by itself. The whole domain of psychoanalysis outside of language, which involves pathogenesis, therapy, and very importantly, supervision. Usually in supervision, the center of the discussion becomes psychoanalysis which operates in language rather than psychoanalysis which is operating between the two outside of language. So there is this whole area of supervision also and training of how psychoanalysis exists and operates outside of language in silence. Second point in this context is, can we explore some specific examples where psychoanalysis has to operate in silence? Take a few examples. First, take the example of a covert passive-aggressive narcissist. The passive aggression and narcissism operates largely outside of language. It can operate in language. In some cases, it may operate largely in language, but it can operate very easily outside of language. Second example of very high envy. The attack of envy on linking. Attack of envy by projective identification, by putting envy into somebody else. All of these are non-linguistic. These things can happen in real life. This can also happen in the therapy room. Example 3, take the case of silence in therapy. The silence can be interpreted in a variety of ways, but the interpretation largely is based on a non-linguistic communication to the therapist, which then he interprets in terms of language. We have discussed before in a separate episode, what does silence mean, different meanings of silence. And I think we have discussed about 15 different meanings of silence in the therapy. Fourth, take the example of buildup of irritation and anger. In therapy or outside, where it is happening outside of language, without any verbal exchange, it's happening. Take the example of the non-linguistic behavioral obstinacy of somebody with obsessive traits, where behind that obstinacy is massive anger, and all the expression is in non-linguistic area. We can also think about severely disturbed, where the primary mode of communication becomes projective identification, or if not primary mode, the most meaningful mode becomes that of projective identification. And this also is outside of language, which later we interpret in terms of language. So these are some of the examples of strong psychoanalytic events taking place outside of language in silence in the therapy room. And the same can happen outside of therapy room in everyday life also. One very important point in this regard is the esoteric concept of the ineffable O, the Bionian O. And this brings us to the, not only to psychoanalysis in silence, but this brings us to this whole fundamental concept of what is healing. There are many interventions which lead to healing. And one of the interventions is an intervention of non-commission, which is the intervention of holding and containment. And if we go deeper into containment, we look at passive containment and active containment. And one specific form of containment is where we allow the ineffable O to happen. And this is as esoteric as it can get. It has to be experienced to be believed. It is a state of silence, and it is a state which the therapist experiences when something turns into a deep healing realization in the patient. And this state often comes by itself, but can be brought about by intentional practice of the therapist with consent of some subtle type from the patient. And when this state is established, it becomes a state of change. And this has always been a prime concern in psychoanalysis. How do you induce the state of change which facilitates change faster than other states? And to bring about the state of this ineffable O, the therapist has to get into a state of peace, of rest, of a passive, aware observer with benevolent goodness, as silent as it can be, and allowing the patient's healing process to make use of this state and convert something into a healing realization. This state of O is not completely understood, and therefore it is necessary to go into this deeper, into what I call the home of O. That if this state is happening, where is this state located? What are the structural and functional components that bring about this state or maintain this state? We have discussed this in a separate episode, the home of O. In a way, it's a spiritual healing experience, a quasi-spiritual healing experience, to be more correct. But all of this business of establishing and healing through the state of O is all in the non-linguistic area. One more very prime example of psychoanalysis working very effectively in silence. Last point to be covered is, can therapists build skill in this area? Yes, it can be built. But skills in terms of silence have to be built by a very different kind of understanding and training, completely opposite of ISTD. And it needs a different kind of supervision also. On the part of the therapist, it needs some practice of meditation, some practice of being still, some practice of exploring thoughts and feelings arising in oneself in response to something non-linguistic. One episode I have done is to do psychoanalysis in a comparative way of two pieces of music, one from Indian classical, second from Western classical, neither of which has language in it. One is completely instrumental, the second involves sound but not language. So that can be used as a skill builder, a very relishable, delicious way to build skills. So we are looking now at two kinds of approaches and skills: healing with language interventions and healing with in silence. So we have psychoanalysis operating in language and psychoanalysis operating in silence.